Sarwar.
Presiding Officer, can I start by congratulating the First Minister on the wonderful news that he's become a grandfather? I'm sure everyone across the chamber, a young grandfather I should emphasise, everyone across this chamber sends their best wishes to all his family on the birth of baby Rua. Presiding Officer, an NHS available and free when you need it. It's the founding principle of our NHS. But under the SNP, that principle, that promise has been broken. Right now, over 100,000 Scots are waiting over a year for hospital treatment, so it's not there when they need it. And just in the last 9 months, over 36,500 private procedures have been paid for by Scots, so it's not free when they need it. Why is the NHS no longer available and free at the point of need under John Swinney and the SNP?
Minister.
First of all, President Officer, can I thank Mr Sarwar for his generous and kind comments about the birth of my first grandson, and also welcome very much his characterisation of me as a young grandfather. That's the most precious remark that's helping me come to terms with all that's going on in my life just now. But his kindness and good wishes, as of many members across Parliament, is very deeply appreciated and will be deeply appreciated by my daughter, her husband and by Rua. So I'm grateful for that. In relation to the National Health Service, Mr Sarwar knows from our exchanges that this is an issue that commands my attention and is an absolute priority for me. I recognise that people are waiting too long for treatment in Scotland today, and we are very focused in the work that the Health Secretary and I are taking forward on reducing those waiting lists. Indeed, it was the subject of a lengthy discussion yesterday between the Health Secretary and I and NHS chief officers around the country. We are in a position where progress has been made. Figures published in February show a 4% decrease in the total waiting list size for diagnostic tests, which is one illustration of the improvements that are being made, and we are determined to focus on further improvements by ensuring that we increase the capacity of the National Health Service, we increase productivity at local level, and we are able to meet the needs of the population. Because the point that Mr Sarwar puts to me in principle of an NHS being available free at the point of need when people require it is exactly what I want to deliver for the people of Scotland.
Anas Sarwar.
I think that's an admission that the First Minister wants to deliver it, but it doesn't exist for patients across the country. And the sad truth is that the NHS isn't even free and available for all those who work in the NHS. Take the experience of an NHS support worker from the west of Scotland. She has worked in our NHS for 35 years. Increasingly unable to walk due to her hip, she was left hobbling to work on crutches. Facing up to 3 years on an NHS waiting list and being forced to retire 9 years early or pay to go private, she took the difficult decision of withdrawing from her modest pension to pay for a private hip operation. The total cost of this to her was £24,000. That's almost her entire annual salary on an operation that should have been free. This is scandalous. So is John Swinney proud that even NHS workers are being forced to pay thousands of pounds of their own money to get the treatment they need?
Minister.
I don't want that to be the case. I want individuals, particularly individuals in the circumstances that Mr Sarwar has put to me, to be able to access healthcare services when they require them, which is why the Health Secretary and I are working so intensively with health boards to increase the capacity and the capability of health boards around the country to deliver more procedures. And that's what it comes down to, being able to deliver more hip and knee operations, to be able to undertake more diagnostic activity. And the investment that has been made available through the Government's budget for the next financial year will help us to strengthen the delivery of those increased numbers of procedures. Now, of course, as Mr Sarwar will know, there is a significant expansion in the waiting list because of the interruption of COVID, which disrupted our healthcare services. We are working to recover from that as quickly as we possibly can do, and I give him my assurance that ministers are entirely focused and have put the financial support in place to make sure this is the case, that we are able to undertake more procedures than we are able to do so in this current financial year.
Anas Sarwar.
This NHS worker is not alone. Based on the data for the first 9 months of 2024, Scots have had to pay an estimated £17.6 million of their own money on cataract treatment, £30.8 million of their own money on hip replacements, an estimated £16 million of their own money on knee replacements, and most shockingly of all, Scots have had to pay thousands of pounds of their own money to fund 700 rounds of chemotherapy. Scots having to pay for cancer care under John Swinney and the SNP. This cannot go on. That's why, as First Minister, I will declare a waiting times emergency. This is your constituents I'm talking about who are having to pay for £1,000 of care. So I think you should reflect on the groaning. Declare a waiting times emergency and do whatever it takes to cut waiting lists across the country so that Scots get the care they need. Because isn't it the case that the SNP are the ones who broke our NHS and they can never be the ones to fix it?
First Minister.
But I think Mr Sarwar's used that line to me once or twice before, and I dare say I'll hear it a few times between now and the elections in May of 2026. But let me just try to address the substance of the points that Mr Sarwar makes. The first point is that on cancer care, I'm concerned about the points that Mr Sarwar has put to me, and I'd happily look in more detail at the issues that he's raised. But on the 31-day standard, 94.3% of patients were treated within 31 days of a decision to treat, with a median wait for treatment of just 4 days. 4 days, which is an exceptional performance. The 62-day standard is still, we're finding difficulty meeting that, but the median wait is 49 days from urgent suspicion of cancer referral to first treatment. Now, in addition to that, the Government is putting in place provisions through the work that is underway just now to deliver over 150,000 extra appointments and procedures. And in relation to some of the additional sites that we're bringing on to undertake orthopaedic appointments, which you asked me about, we expect to be able to deliver over 2,500 extra procedures in those sites. But of course, that's only possible because the Government's budget has been approved by Parliament, which invests a record amount of money in the National Health Service. Now, Mr Sarwar can say to Parliament
First Minister.
all he wants about his intentions for the years to come if he has the opportunity. But in the here and now, today, when Parliament faced the decision, are we going to fund the NHS to the level required, Mr Sarwar was posted missing.
Question number